new to my channel, welcome. Please leave a comment down below, say hello, and allow me to welcome you to the channel. Also subscribe. I get more views than subscriptions, which is interesting, but subscribe and ring the bell if you would like to get notified. If you are a returning subscriber, you know how much I just care about you and I love you, and I'm giving you all virtual hugs, which is true.
Just when I thought it was safe, Paytas released another video. This one was an hour and 10 minutes long.
Oh God.
Many of her videos are like a stream of consciousness. To say that they appear unplanned is a bit of an understatement. This one was bad even by those standards.
Okay.
Trying to summarize this video is like trying to summarize a bunch of random words.
Right.
The summary is that they are random words. She talks...
Oh, Dr. Grande, you validate me so much. I have been saying this so many times. I've said Trisha's sentences and her words are gibberish. She doesn't mean anything. You can't take anything. She's like Chris Watts. You can't think that Chris Watts is ever telling you the truth because he has lied so many times. It's the same thing. Many of you know Dr. Grande. He is on YouTube. He has his own channel, and I like Dr. Grande very, very much. He's very knowledgeable. And so what I love about the beginning of this video is he packs it really together in a great description just to give you an overall sense of what we are talking about. Let's watch.
Players move to a description of what happened across these various videos, and then I'll offer my analysis. The three key players here would be Trisha Paytas, Ethan Klein, and Dr. Pinsky.
Yes!
Trisha Paytas is a popular YouTube content creator with about 5 million subscribers. She is kind of an anti-hero who is known for having a flair for the dramatic.
Yes.
There are various theories about how she has difficulty regulating her emotions. She claims to have borderline personality disorder. Ethan Klein operates a podcast called Frenemies,
yes,
which features Paytas. The videos are released on a YouTube channel called H3 Podcast, which has over 2 million subscribers. Klein also has another channel with over 6 million subscribers. Drew Pinsky goes by the name Dr. Drew. He is a physician who is active in media production. On his website, he refers to himself as an unprecedented reservoir of expertise. The website also states that he has been...
But he has a reservoir of expertise in specifically addiction, okay? In chemical addictions, any kind of addictions. That is his area of expertise.
Regarded as a beacon of truth, integrity, fairness, and common sense. So I'm going to guess that low self-esteem is not one of his problems. Pinsky has been involved in a number of controversies that are beyond the scope of this video. Perhaps I can record a separate video just about him, but just to offer one example, he claimed that the coronavirus was not as dangerous as the flu, suggesting that there was a press-induced panic. As it turns out, we know he was incorrect. Therefore, this seems to be a case of Pinsky-induced nonsensical thinking.
Whoa! Whoa, Dr. Grande, Pinsky-induced nonsensical thinking. And you know, that is exactly what I thought of Dr. Drew. Has he commented, invalidated Ethan's feelings, and pacified Trisha.
And by the way, and then there's more. There's more because
I don't need more. I don't want.
There is more. This is important.
Break it down for this part,
No,
and then have to reply to what
important.
you said.
There's one more piece that I think is important.
All right, go ahead.
When I ask Moses, when Eli asks Moses about it, Moses says, "I didn't say that."
Yeah, that's actually not important. So
Actually, it is important, Dr. Drew, because something is happening there. See, I don't know what Dr. Drew's about to say because I forgot. We're going to get into it. But at this point, he needs to look at Trisha and say, Trisha, is Moses actually literally saying these things to you? Yes or no?
And Pinsky. So now moving back to the storming out video. Paytas and Klein got into an argument after Klein mentioned that his wife did not want to be the topic of conversation on the podcast. As I understand it, Paytas is romantically involved with a man named Moses, who is Klein's wife's brother.
Yes.
The relationship between all these people was at issue. Paytas had made comments that allegedly put a strain on those relationships.
Yes.
Paytas started getting angry, indignant, and using expletives. She felt as though Klein's wife was taking a position that she was too good to be talked about on the show.
True.
Klein said he did not know what to do because Paytas was having a moment. He did appear to be genuinely confused. But then he proceeds to keep the dialogue going, clearly straying into a volatile area.
The one time that Ethan did that, and I completely agree, is when Trisha said, and it's probably because Ethan had had enough, because usually Ethan walks on eggshells with Trisha and tries to treat her very sensitive, not to push her buttons. But when Trisha, during this argument, came out of nowhere and says, I wouldn't have a nanny. You know what? I can't say that I blame Ethan. If you watch that video, I do say, no, quiet to Ethan while he keeps, asking her questions, because that's not the time to be asking someone questions when they're in a, psychotic state. That's not a time to be asking them, well, what should we do? How should we do our parenting skills? But at the same time, if I was, or any of us were in Ethan's shoes, holding that whole conversation together, trying to hold it until the end of the podcast, I can see very easily where you can get manipulated into Trisha's playground, right? And that's what happened.
Actually, he makes a better effort to pivot away from the topic, but Paytas brought up Klein's use of a nanny. Later, Paytas refers to this as a jab.
Yeah.
Klein then starts provoking the situation, even though Paytas signals that she wants to move on.
I don't want to come back here for real, to the house, because I don't feel comfortable. It's your house, I don't want to be in here.
You don't want to eat the pizza?
Oh my
We
God.
can finish this episode, but I'm just telling you.
Are you still excited for the pizza or not?
Right? Yeah, I can't wait.
That's sarcastic. I'm still excited for the pizza. Can we move past this?
When I have a kid, I'm not gonna have nannies. That's for damn sure.
Oh, great.
Paytas accuses Klein of making light of the fact that she doesn't have children.
Yeah, I'm
Bad
asking
idea.
help scheduling my life around
Okay.
Theodore.
Alright.
So I'm doing a podcast now, so Hila should be at home for sure. And then when I'm done with the podcast, she can go to the office and I'll be with Theodore.
Yeah, I think that's
Yeah.
a great schedule.
Okay. And do you know what it's like being with a 1.5-year-old?
Of course not, because I don't have a parent.
Right.
It's a little insensitive because I'm infertile, and it's a really issue that I struggle
Well,
with.
I
so
ask is because you
I don't
realize that
have
you
kids.
can't do any
so when
work
I'm
when you're
saying
with.
that, you're saying, do you have kids, or are you in my face that I don't?
Another trigger.
No, that's not what I was doing.
It's exactly what you were doing, because you know I don't have kids.
No,
so why
my
would you
point,
ask
my
a question
point was that
you know?
you're. Trisha comes on the show, and she frequently repeats stuff that Moses tells her. So let me just finish my point, and then you can respond. So, for example, Trisha will say, and you did say in that episode, Moses doesn't even like you guys anyway.
True.
Or she says she's joking when she says stuff like this, but
All the
she
time.
goes, well, she says of Ela's mom, Moses' mom, he's not very close with her, and she wouldn't be invited to our wedding. Or you got.
I just want to let you guys know that I watched a video of H3 that was filmed like 6 or 7 years ago, a long time ago. I found it, and it was in Israel, and it was of Ela and Ethan going to visit her parents. And when they get there, Moses is there, gorgeous as can be. I mean, gorgeous. He is a very handsome man. Now, this is 7 years ago, so he's 7 years older. But, he, I think that if he ate a little better, he would be even more gorgeous than he is already. I really do. I think his diet has gone downhill since he's met Trisha, obviously. But, because how you eat really affects how you look, and how you end up aging has to do with how you eat. There is a direct correlation there. And my point being that that was when I first saw Ela and Moses's mom. Oh my God, you guys. I swear to God, when I've when I've spoken about Moses's mom, Elah's mother before, their mom, in my mind, I saw like, some older gray-haired lady. I'm thinking about my mom, rest in peace. But I'm thinking like of some of my mother's moms, back in the day, No, I never expected her, Elah and Moses's mother to be so gorgeous. She is so beautiful. And you can see when she's talking, there's a little snippet of her, saying a couple things, how beautiful her heart is. And when I saw her, I really was feeling the pain in my heart. And I was thinking, God, I wonder if she actually saw what Trisha said or heard what she said, or she knows about any of this. And I hope she doesn't, because it's pointless. It is pointless. Trisha will probably end up going to Israel, meeting their parents, and hopefully, mark my words, not think less of them, and don't put them down because they don't live like millionaires. Maybe they are, but it doesn't matter. They live like we do, like your parents do, like my parents do. They look like a wonderful, beautiful family, and it hurts me if Trisha is going to go into this family, like go to Israel, right, and start judging. And we will see if that happens. I pray that it doesn't. I pray that she goes there and she allows to feel their love and is accepting of other people's cultures and how they live. Let's just hope that that happens. But with the lack of cultural education, I was going to say academic, that too, but with the lack of cultural education, I don't put it past Trisha to be judgmental. And that hurts me. Their mother is absolutely stunning. Let's see what Trisha has to say with that. Is Trisha making all this up, or is Moses playing with Trisha's mental illness, putting this stuff in her head? We don't know. But if we ask the right questions, and this episode is a missed opportunity on Trisha Paytas. It is a very, very sad thing that happened to Trisha, because she had an opportunity here to get help from someone that she's like, ew, Dr. Drew. She even says in this podcast in not so many words that she wants to have sex with Dr. Drew. Okay? Because you know how she is. Everybody she wants to have sex with. Because Trisha said, why would someone talk to her, pay attention to her, want to be her friend, or just hang out with her if it wasn't for them wanting to have sex with her? That's how her mind works.
Okay.
Hey, relax. Trisha, do you know what splitting behaviors are?
Splitting,
We talked a little bit about it last time. It's where it has many different sort of features. One of it is presenting differently to different people, or presenting different aspects of the truth to different people, or splitting one person's point of view with another. Like if Ethan says, I like green, you go, well, Moses says you don't like green, and Moses likes blue. That's splitting people. Does that feel familiar to you?
yes.
Splitting in the context of borderline personality disorder and defense mechanisms is when a person tends to see an object, usually a person, as all good or all bad.
Okay, so that's what splitting is. A person who sees another person has all good or all bad. What was failed to mention is that when Trisha is in her psychotic state, when she's at that state that she says she can't turn it off, right? The only way she sees her subject is all bad. She can't see any good in them. That's why she continues berating them and saying it gets worse and worse with her literal abuse that I feel that Dr. Drew gives her a pass on. Her literal abuse of others.
The way this expresses in borderline is referred to as idealization and evaluation. Someone with this disorder will love somebody one moment and hate them the next moment.
Okay.
There is no gray area.
Okay.
We don't see a continuum. We see dichotomous thinking.
Right.
Pinsky then makes it seem like Klein should not have responded to the splitting Again, he described splitting wrong, so it gets confusing.
Right.
I take it to mean Pinsky believed Klein's behavior exacerbated the anger episode of Paytas.
That's not true. By the time Ethan came in and did the wrong thing, according to my opinion, by asking too many questions and really going into the playground with Trisha's mind about I wouldn't have a nanny. See, by the time he did that, you could look at the video where that happened. Trisha had already exploded. She had already been up there when she said that.
Now, I do think that Klein antagonized Paytas in the storming out episode, but the way that Pinsky framed this really shifts the blame over to Klein.
Yeah.
It made it seem like Klein should just retreat whenever Paytas gets frustrated, loud, obnoxious, and insulting.
No, wait a minute, Dr. Drew, that was so wrong of you. You're putting the responsibility, the accountability, you're putting the heavy weight on Klein, on Ethan. Dr. Drew, that's what you did. You put it on Ethan. It's your responsibility to do this and do that and do that. Where does Trisha's responsibility come in?
And you have talked about your personality issues, and one of those issues is you'll have a tendency to split. You just will.
Yeah.
And Ethan, your job is to not respond to splitting.
Yeah, but she's driving. But I can't. If she's my wife.
You're allowed. I got to get on your case for this one. You are allowing the wedge to be put into place. She is doing what she does. She is doing her splitting thing, and your job is to go,
Doctor,
how dare you? How dare you?
I'm not the one being split.
Here's another area where Pinsky doesn't seem to understand cluster B personality pathology, which I guess makes sense because he's a physician and not a mental health counselor. Either way, he is acting like he knows what he's talking about.
Thank you.
On this topic, even though the evidence supports the opposite conclusion.
Exactly.
What Paytas did here was boundary crossing, which is extremely common with BPD. When boundaries are crossed by a person with BPD, the other person needs to maintain their own boundaries. Giving in to the boundary crossing, retreating, is not going to make things better.
Right.
It will not change the course of the disorder. It will not improve the relationship.
No.
It is often better to resist the attempt at manipulation, to show that you're willing to stand up for reason and common sense, rather than walking on eggshells.
And
my wife is being driven apart from her brother and his own family and mom.
I know this? No one told me this prior to last week. I thought it was a jab. It's like he jabs me.
Okay, so there Trisha goes with another excuse. All right? She says, no one, this is common sense, Trisha. It's common sense that if you're having a conversation with someone on a podcast and they say right there on the podcast, can you not talk about Gila? Why can't you just let it go? And if you have a problem with that, legitimately, you could bring it up in private. Like, I don't understand why we can't talk about Hila. And then maybe you would have understood then, even though I highly do not believe that you would understood then. I just don't believe it. Because you don't seem to get, Trisha, a lot of commonsensical things.
Yes, it's splitting, and yes, I know I was jabbing him. Told me I did it on the show multiple times, and you cut out a joke about his mom one time and never even explained to me why you cut it out. You could have been like, hey, we're going to cut that, but don't say it in the future.
When you would do it, I would say you have... There was times when you would say it, I say you have to stop doing it.
On camera, which I take all this as entertainment, just like I say stop it, that's uncomfortable. Like on camera, okay, if you tell me off camera, hey, this is a real serious issue, just stop.
Oh, you guys. You see what Trisha is doing? If you would have told me this before, I would have known and not done it. No, you wouldn't have, Trisha. Ethan confided to you that at one time he was taking some medication for something. You turned it all around and said he was taking drugs, right? So what she is saying right now holds no validity. My opinion. My opinion.
You never once said that. You've always said it on camera, and I always thought we were jesting back and forth.
Later, if you're able to substantiate these things and find out that Moses is not trustworthy or does feel the way that Trisha's telling you, well, then it's something to talk about.
Right.
But in the meantime, it's just whatever. Don't react.
But wait, Dr. Drew, how can you possibly tell Ethan not to react when they're having a show? Why aren't you focusing on Trisha when she's the one who's initiating this behavior? I don't get Dr. Drew.
Saying, so let's say Moses said, so Trisha comes on, she says, Moses says she doesn't even like you guys. And then Ela says, hey, why do you keep saying this shit to Trisha?
She never said that.
Right.
I asked you, do you really want this? Because you were pushing for me to give you responses.
We don't have the clip, so they couldn't possibly know the context, so there's no point of
Well, we have a clip. It's very easy to show them. It's online.
She was at the peak of her anger.
Oh my God, Trisha doesn't get that it's insignificant. You guys, if I was there, I have a degree in psychology. I'm not a working licensed professional in that field, okay? But if I was there, people get so carried away in the ethers. That's what's happening right now. It wasn't what Ethan did when she said that. Yeah, he should have been this, that, and the other. How much do you expect from him? To be perfect all the time, walking on those eggshells? It is not all Ethan's responsibility. It's not.
That wasn't the peak of my anger. The peak of my anger is at the end.
Okay, well, she was right.
That's a lie.
To it.
I realized what he was doing. He was pushing for a reaction. I'm like, okay, do you really want my opinion on this situation?
No, I wasn't pushing for a reaction. I was trying to make you own what you said.
Right.
No, you kept asking me, oh, so now my mom's a bad grandma.
That sounds a little bit aggressive. What does that mean?
Because she says, we came to like a point where she's like, let's just move on. And I said, great, let's move on.
Right.
There's like a moment of silence, and then she says, I'll tell you one thing. If I was lucky enough to have a kid, I wouldn't have a nanny.
Mm-hmm. And that was a jab, and I admit that. But he pushed. Oh, I have no problem
We already
with it.
talked about this.
Okay, but you just asked me to give you an opinion again about it.
I heard your opinion. I heard it.
I don't care to share it again. I'm just saying, like, if he wants me to
Because you're like
reply, I will.
sugarcoat, like it's very obvious that she was in that moment digging as deep as possible.
Right.
I was not digging it. He was pushing it.
Oh,
Okay.
yes, you were, Trisha.
You know also, Trisha, that one of your things is unregulated aggression, hostility. Once it gets going, it goes, right?
Yeah.
Right.
Yeah, and then Ethan somehow can't handle that when that happens.
I can handle it.
Oh, come on, Dr. Drew. Are you freaking kidding me? Ethan handled it the whole podcast. It was that one thing that he messed up on, and I was watching, and I even said, stop. I was trying to stop him from talking. He made a mistake. He handles it just fine. Oh, Dr. Drew.
You escalated as opposed to just containing it. And so
You gotta watch the clip.
Yeah, that was a long time into it.
Yeah. But I want to go back to something that I found curious. Why were you so embarrassed, Trisha? That sort of surprised me. Was there what you did on social media when you were in that state of unregulated aggression?
Yeah, I think because, like, I don't think that's ever been out there like that. I obviously, like, that very end of it, after all of that, when I realized, like, he's pushing me for a reaction, which I'm happy to give. I'm happy to be that person because, like, I know it can be entertaining or whatever, and I'm fine to be that way. It just was more embarrassing that I let it go so far where I called, like, his wife really bad names. I called her the C word, the B word. I just was cursing out a storm. Like, I honestly don't even remember that part. I remember the nanny part. I remember all that.
How can you not remember that part and just said what you did? Oh, you guys. Wow.
I don't remember. All of a sudden, my boyfriend comes in with the pizza. It seems like it's a big joke, and people are like laughing. And this is my perception. It may not have been that way. And then all of a sudden, I was thinking, like, oh my God, this is it. So my final thing was to just end it. I thought, you know, every time I curse someone out or go too far with someone's wife or something, like my ex-boyfriend, I cursed out his wife and then he broke up with me. That was the final straw. I thought this will be the final straw, ex-wife. And so I thought, like, okay, I'll just end it. Like, I'm gonna just go this way and make sure we never talk again, and that's it, and that's fine, and people get what they want.
Ethan, or you and Ela, or you and everybody?
Me and Ethan, like, when I went to the car, I was hysterical and like hyperventilating because yeah.
So you've described to me before when you get in these states, you sort of black out. Were you in one of these sort of blackout?
I think towards the end, because I don't remember. It was embarrassing to watch it. I saw it on TikTok, and like I don't remember saying all of that. But I did feel immediately embarrassed when I heard that, because I was like, wow, I literally. Everyone in the comments said that too, like, you went too far, she's attacking your wife, and I agree. I'm in their house, and their kid was upstairs, and their child was upstairs, and I was like yelling and cursing all the way up the stairs, and it just was really embarrassing. Like, that part wasn't, I mean, I was aware of it, but it was like, I just couldn't do anything. I just kept cursing all the way up the stairs. It was, I don't know.
Can I say something?
Well, this is quickly, I want to commend both of you for being together, being in the studio. Let's really start from there. You know, you're trying to get your relationship back together, and it took a lot for you guys to be sitting here as you are.
I don't think so, Dr. Drew. The reason Trisha is there is because of you, and you're somewhat of a celebrity, and she's like wanting guests that are, ooh, she's gonna even say she wants to be on your show. Get her number, Dr. Drew. It's not like they had to do all this work to come up there. They came there just to have the views, the money, and be with you to give them more clout. Period.
So I want to say that I don't know what it is exactly you feel when you get to that heightened state of emotion, but in my mind, I'm never thinking like, oh, she's out of my life forever, she's done. I'm feeling like, well, we could, like I said to you, let's talk later.
Mm-hmm.
It's
Why?
not like, oh, you're out of my life forever.
Why
You know?
not?
Like she said something like, I'm going, I'm quitting, yada, yada, yada. She called, she said all these bad words. And in my mind, it wasn't like, bye forever. I said, why don't you leave and we'll talk later.
In my mind, that means bye forever, because everyone says that, and then it's bye forever. Like, with every situation that I've been in life, like David and Jason and all that, like, it was.
Here we go.
I did one mess up.
David and Jason.
That, went on a rampage, and then they said bye forever. They just cut me out after being a year and a half together every day with both of them, and it was just like bye forever, and that's how it always is. So.
This might be the right time to get into the study, the test.
Yeah.
Because some of the things you scored high on is associated with a lot of difficulty with shame and abandonment, and you'll blow things up as opposed to having somebody leave you. You know what I mean?
Yeah.
Right?
For sure.
And so this all sort of is borne out in some of the data we collected, and I think we ought to get into that. And before we do, I want to point out, these guys are not our patients. They're not human subjects. They've asked us to do these testing to sort of, just part of it is just to sort of objectify some of the stuff you guys talked about, and it's kind of interesting. You guys.
I doubt that Ethan and Trisha asked specifically for these two tests. I don't even think Ethan and Trisha know or knew what these two tests represent. Obviously, Trisha didn't take it seriously because she took drugs before doing the test. Dr. Drew, what are you doing? You know, Dr. Drew is making an appearance on here because he got paid. He has a fee. He just doesn't do this for free. This is how Dr. Drew makes money publicly, by doing these shows. That's how what he's known for. Okay, so that's why Dr. Drew is here, right? Trisha and Ethan are here today. I believe Ethan more so in trying to find a way to continue the podcast with some sort of serenity. Why? That's where I get, I'm going to answer my own question, why, but this is where I get tripped up. Why is Trisha Paytas being in this podcast at the cost of humiliating, creating a wedge, all of the horrible things that she has done and said towards Hila's family and towards Ethan and Hila and their home and their baby and everything? Why have the negative energy there? She can still date Moses. You can still have the kind of relationship with her with occasional birthdays and Christmases or Hanukkah or whatever, and have your social gatherings with her. But she doesn't have to be ingrained, inside your home, in your kitchen, which is what she wants, right? That's what Trisha wants, because it's a beautiful house and she just wants to be there. She always wants to flex. So her motives, Trisha's motives, are always ulterior motives. She always has a secondary gain in hand. Her secondary gain is her first gain. Views, money, fame, more sex, more being an exhibitionist. These are Trisha Paytas's goals. That's what, she may not write these goals down and say, these are my goals, but those are her goals from what we can see, right?
You said you had that to what? Oh, to a T.
Last year, yeah, to every relationship. Like, I cannot function if I don't have someone in my life to manage me, and to also just have someone. I can't function. I can't function without a boyfriend.
Yeah. So does that mean that you're using whatever boyfriend you get? Does that mean that Trisha's not really in love with Moses, but she could be in love with any man that pays attention to her because she doesn't have any parameters, like she doesn't have any boundaries with these men. What the hell? Oh my God, you guys.
It's about how people advocate for mental health until they see it. This whole mess was exposing the ugly side of mental health. She did not want to be a troll on the internet. She said that I have freedom because I'm just me and people expect so little. That was really one of my favorite lines.
Wow. Wow. Self-deprecating. Trisha said, I have freedom because people expect so little of me. So basically, because people expect so little of Trisha, it gives her permission that it's okay to be, gross, to put out the worst of the worst, because it doesn't matter because people expect so little of her. So where does self-improvement come in, Trisha? Where does self-awareness come in if that's what you're going to do? It doesn't. And that is where I have given Ethan Klein a lot of credit, is when, or anyone, to be honest, anyone, even on a clip that I saw, it was a video that Trisha released with Moses, just them hanging out, and Trisha starts like picking on her leg, picking on her skin, on her leg or something, and Moses so kindly reminds her, because they're on camera, they're filming something, Moses so kindly reminds her, we have guests. We're filming. And Trisha's like, what am I doing? I don't know. She said something like, I'm scratching to make it bleed, or I don't know. And that's not what she said. She says something like she was doing something, I don't know, that was just crazy. And Moses even said, even more so. Because like Trisha didn't know that a pita, that you open it up and you put why am I saying that? Because it's general information about her mind. She didn't even know how pita bread works. Now she knows. She doesn't care.
When somebody does retreat, this is called the rolling over and playing dead strategy of dealing with cluster B personality pathology. Some people justify it by saying it works for possums. But actually, possums don't play dead. When possums appear to be playing dead, they have actually entered a catatonic state in response to fear. This is referred to as tonic immobility. It is involuntary. Even though it might be tempting to imitate a catatonic state in response to Paytas, it's probably not a good idea. I agree that Klein should not have antagonized Paytas,
yes,
but that's something different than standing up for rational thinking.
Mm-hmm.
Pinsky was surprised that Paytas was embarrassed about her behavior. If she actually has BPD, then this wouldn't be surprising at all. It would actually be expected.
Whoa, this guy is smart, right? But remember, this is one person's analysis, one person's view of how he saw this podcast and Dr. Drew fail Trisha Paytas at a time where Dr. Drew could have made a big difference. Dr. Drew is such a, how can I explain it? Such a well-known personality. That's why Trisha's like, oh, I want to know what you got to say. Because anyone who has like any fame, right? And then even Trisha's like, oh, maybe I can be in Dr. Drew's show. I want anything like that. Trisha's like, oh, right? And it kind of, ooh, fame, right? And she'll do anything for that. So what an opportunity Dr. Drew had. Because see, the whole time I thought he was just trying to gain Trisha's trust, just to try to gain her confidence so that she'll open up to him. But then I found out Dr. Drew said, you're not my patient, to Trisha. So it's like Dr. Drew's probably never going to treat Trisha, but if he can, she has the money to be treated by Dr. Drew or some other professional.
Individuals with this disorder are often embarrassed after an outburst. After this misinformation session by Pinsky, we find out that Paytas and Klein took 2 tests, the Narcissistic Personality Inventory and a test that measures the dark triad traits, which are narcissism, psychopathy, and Machiavellianism.
Okay, we're going to go into this, but what I want to know is why is it on the H3 podcast, they didn't explain to us viewers, because probably they didn't know, what was the purpose of Dr. Drew taking these tests? Okay, because I know that Ethan did the second one where he said someone in our crew is a psychopath. No, I didn't watch that, and it's almost like, like a joke. Psychopaths are not funny. But that's the title that he used. Okay, I did not watch the video. I don't know if someone literally scored as a psychopath, but psychopathy is it's not funny. It's not something to joke about. And Ethan did use that as a title. Someone on our crew is a psychopath. That's not funny.
These instruments focus on a narrow segment of personality theory. I wouldn't necessarily expect somebody with BPD to have dramatically elevated psychopathy or Machiavellianism. However, there is a type of narcissism called vulnerable narcissism, which does have some overlap with BPD. So really, these two assessments would not be expected to reveal much about the situation. And when we look at the results, we see that they don't. Paytas was using substances when she took the assessments.
Oh my God, you guys, how stupid! Can I please say the word stupid without don't come for me. How stupid can you be when you're going to take a psychological exam, right? And you take drugs, and that invalidates the results. What does that tell you? What does that tell you?
So the results are invalid.
Of course.
And Klein had low scores. Pinsky
I don't understand Klein getting low scores, why that would invalidate. I don't think it invalidates his results. I think Klein did the best he could. I didn't hear that he was on any drugs or drinking or anything. So I'm sure that his results are good. I think they're valid.
Three statements about these constructs that I want to critique.
Okay.
Number one, he said that sociopaths were attracted to people with BPD. This is correct. Pinsky didn't know the reason why this happens. In part, it is due to the fact that people with BPD are often promiscuous and sociopaths are sensation-seeking. Additionally, the traumatic component of BPD doesn't bother sociopaths as much because they have a lack of empathy. They are resistant to the type of manipulation associated with BPD. Number two, he said that sociopaths can understand how others feel, which they use to manipulate others, while psychopaths feel nothing. This isn't quite right.
Okay.
Both sociopaths and psychopaths are manipulative.
Okay.
In reality, sociopaths are more emotionally reactive and psychopaths are more manipulative. Number three, Pinsky said that we want naval aviators who land on carriers to be narcissistic. No, we don't. We want them to be psychopathic. They don't need to be arrogant, condescending, and envious to land an aircraft. They need to be calm under pressure. The portion of Pinsky wraps up with him saying that Paytas and Klein are in a more connected place.
Liar.
Based on what is observable, I find that statement naive.
Thank you.
Now, stepping back and taking a look at this whole situation.
Yes.
I think there's something qualitatively different about people producing videos that contain trauma, and the same thing happening when it involves mental disorders.
Right.
For example, if somebody was going to record a video of a person drinking alcohol, there's a difference between featuring that behavior with somebody who's not addicted to alcohol.
Right.
And using someone who is.
Right.
Even still, there's no clear picture about what should be done in this situation. On one hand, I can appreciate the argument that Paytas should focus more on her recovery and distance herself from the trauma.
Right.
On the other hand, even though BPD does tend to improve with age, it is still somewhat stable over the lifespan. So why shouldn't Paytas be allowed to simply live her life?
Good
If that
point.
involves recording videos featuring her symptoms, that is her prerogative.
Good point.
As much as some of her videos bother me, mostly due to the disorganization, the content, the length, the poor planning, really too much to list here, she does make some good points. She has focused a light on the topic.
This is December 2020. I think that this has been a very challenging year for her. I think it's going to get more challenging. I know a lot of I was going to say a lot of us, but I can say that, myself included, we're waiting to see what happens with the house and how that goes, and the party and the drama and the chaos that we're going to have in the house. But just remember, this is Trisha Paytas is a live human being, and she is literally suffering. No one can be happy like this. You know, if you're projecting, or if you're saying things that you don't mean, or you get mad, you know, or you hit someone, or you know, get just the sooner you just look at it, especially these days, there's no shame in anything. The sooner you look at it and you say, you know what? And right now is a great time for counseling because of COVID-19. It's mostly on the phone, you know, or you can do what's it called? FaceTime or something. But right now is a great time. Everyone should be in counseling right now just because of COVID and what we're going in through society. But you guys just, I don't know, what am I saying? Just keep your thoughts for Trisha. I know that, you know, we can talk about her behavior, but at the end of the day, she is suffering and she is a human being. And I do feel really bad for her. And yeah, sorry it was such a sad video, but I'll see you in my next one. Bye.